Marking the 2-year anniversary since Ontario declared its first COVID-19 state of emergency, the agenda this week assessed the true global death toll, reflected on how we've all changed during the pandemic, and learned some helpful history about the coronavirus. The agenda's week in review begins considering what the future with fewer restrictions looks like.
I'm hopeful that I think Canadians overall are pretty mellow people, pretty respectful. And I think I wrote a column on this just the other day saying that's what we have to do, just to respect each other's opinion. Life is not a trucker convoy. I think most people out there are quite decent with each other, understanding. I was on an elevator the other day. I had a mask on. Someone got on. They started being very Canadian, apologizing profusely, sorry, I don't have my mask. And I'm like, listen, we can all make our own choice. I think that's what we have to do in this in-between period, is just give each other some slack on this, and life goes on.
That is a very Canadian anecdote, I have to say. Yeah, and which I'm sure many people listening and watching to us right now have also experienced themselves. Dr. Uni, you mentioned pretending is not a great strategy just a moment ago. And I want to compare two countries here, not your original Switzerland, but we've seen numbers from Denmark and South Korea. Denmark dropped the mask mandates. South Korea kept its mask mandates. South Korea's numbers don't seem to be any better than Denmark's. What are we to infer from that?
So I think we really just have a bit of a different situation, just in these two places. I don't believe that you can compare it because the social situation is different, the background immunity is different, etc. And again, as I said before, what you see in places like Denmark or Switzerland just indicate once you lift all the restrictions, you will experience a wave. We won't start from scratch here because we have experienced an Omicron wave that we controlled relatively well. And what then happens if you lift all restrictions and go back to normal, you will need roughly, that's what we see in Iceland, in Denmark. And it probably also, depending on the situation and the social circumstances, etc., could happen in other places too, that roughly about 45% of the population will need to get infected before a wave starts to peak and we start to see numbers go down. Now, if you just reach these 45% with an extreme peak, your way to go down is a long way. And what happens is that once you're down, at the end of the wave, you have infected 90% of the population. We would like to avoid that, and this won't happen in Ontario. No. Why? We already have roughly perhaps 25 to 30% of the population now infected, and we just have to go probably another 15% or so of the population. Once these 15% are infected, we start to be not wobbly anymore, but relatively stable and continue to go down with our numbers. No? So you need to be really careful. The background immunity that we have, in various places is different. It depends on the vaccination rollout, but it also depends on how many people were actually infected. And when you look at Denmark, they had a considerable Delta wave already, which again helped with the background immunity of the population. Sadly so, but it's a fact.
Okay, in our last 5 minutes here, let's look at next steps. And Sabina, maybe you could start us off on this. We are obviously, for a whole bunch of reasons, not testing now in as widespread or as deep a way as we did when this thing started, or frankly, for that matter, even 2 or 3 months ago. You got any concerns about that as we start to take our masks off?
We're at a point where we need to invest into our infrastructure, especially into testing infrastructure, because that is what's going to guide us in terms of what we're going to do next steps. If we wait for hospitalization numbers, knowing that they're a lagging factor, it's going to be too late. We need to be proactive. We need to be using preventative measures. And the reason is because no one wants to go into another lockdown. I don't want another lockdown. You don't want another lockdown. No one wants a lockdown. And the way we can do that, the way we can actually prevent having lockdowns and other stringent measures in place is by having things like masking and testing and some of the other infrastructures in place so that we don't actually get into more restrictions. And in fact, we're able to continue to loosen things as we go along. So absolutely, I think that we have to be investing into our infrastructure in the next coming weeks.
Andre, what's your view on that? We've really de-emphasized testing a lot more recently than we did, say, 6 months ago.
Well, my concern is it's not just testing, it's what are the metrics when things go south again? If numbers start spiking up, that's the problem. The fundamental problem with what's happening is I can live with restrictions being lifted. I think politics matter, that we have to respond to the public being fed up. That's all okay. But I don't like having an arbitrary date. Well, we're dropping an arbitrary date. So what's going to happen if things go bad again? Are we going to have an arbitrary date to bring back masking or vaccine passports? That's what's lacking in here is why did you do it? What's going to be the trigger to act again? That's my biggest concern. And testing is obviously a part of that. I don't think we have to do testing like we did in 2020. It's a different world, but we have to use our testing more smartly, and we have to use it as a trigger for action, whether it's positivity rate or whatever. We don't have to pay as much attention to cases, but we have to have measures, hospitalizations, positivity rate, and make them clear to the public. Here's what's going to happen if things go badly again.
Barbara, I wonder if I could start with you, because we're going to show a chart in just a second that distinguishes between what they call official COVID deaths and excess COVID deaths. So let's start with a definition. What's the difference between those two?
Yeah, so official COVID deaths are what you see in your favorite tracker, be it the Bing tracker, be it New York Times, be it the Our World in Data. These are deaths that are reported by Ministry of Health in different countries, official statistics departments. Different countries have different convention about who releases these numbers. So these are usually following and attached to a positive SARS-CoV-2 test, and sometimes there is a lag between reporting of deaths. But then the excess deaths are defined as the net difference between the total all-cause mortality that happened during the pandemic and the number that would have been expected had we followed past mortality trends. This is sort of a global summative measure of what happened to human mortality during the pandemic period. So the official deaths are COVID-related deaths that are mapped by released officially, and the excess deaths, it's sort of like a total toll of the pandemic.
Sandra, come on in here and say why you believe it's important to distinguish the difference between those two categories.
Yeah, sure. So I think one thing that was learned very early on is that COVID-19 cases do not count COVID-19 infections, and COVID-19 deaths do not count all who die because of the pandemic. And so if you want an accurate picture of what the pandemic actually has looked like, you need to go to some other number, and that number is excess deaths. And so what we have done here at The Economist is that we have constructed a model to estimate excess deaths in all countries, and in that way obtain an accurate measure of the pandemic's true death toll. And we update this every morning.
Is that to say, Sandra, that you do not believe the quote-unquote official COVID death number is accurate enough?
What I believe is that excess deaths is both theoretically and practically superior as a measure of the pandemic's death toll. And I say that meaning that practically, it is unfortunately the case that in poor countries, testing is very limited. And that means that you will only capture a very small number of those who die of COVID-19 in the official death toll. Even in very rich countries, you see a difference between the number of people captured in excess death tolls and the number of people in the official death toll. Now, conceptually, there's also this difference, which is that excess death also captures things like overburdened hospitals and people not seeking healthcare, which is part of the pandemic and should be counted as such.
Okay, understood. Tara, let me bring you in here at this point, and let's focus on the Canadian situation. And I wonder, because I know we've had great debates, even on this program, about what constitutes a death from COVID-19 versus with COVID-19, all of that. In your judgment, what comprises a COVID-19 death?
Well, this is a difficult question to answer because a lot of people may die prematurely because, for example, say they have an underlying health condition and COVID-19 infection accelerates their death. So the two together work together to make the person die sooner than they would have normally. So it's actually very hard to distinguish between deaths with and of COVID. And what you really need to do is determine that statistically almost after the fact. So if you report all of your deaths as recommended by the World Health Organization, the Public Health Agency of Canada, then you would report all deaths. Sorry, my cat's going to join. You would go away, kitty.
This will not be the first time that a pet tried to have a cameo on this program, so it's okay.
No, I know. So you could determine that more readily after the fact, because you can look at what percentage of, if you completely report your COVID deaths, you can look at what percentage of them likely would have occurred in the particular age group of people, how many of them would have died of other causes. But trying to do it at the time is very challenging to do, and can lead to a lot of underreporting of COVID deaths. And I think we're going to see that with the excess mortality. Unfortunately, in Canada, death reporting for excess mortality is so delayed compared to most OECD countries that we still really won't know what's happened in the Omicron wave, for example, for another year or so.
Does it feel to you like this thing is now, if not over, at least coming to an end?
Yes and no. We're into March break in Ontario, of course, and the vast majority of students are away from school, and many of them will be traveling either alone or with their parents, and then coming back to school where no mask is going to be required. I hate to get too political here, but I just wonder if it's a little too much too soon to come into this situation, and should we not wait a little bit? I understand the political science of some decisions, and I also hear and read and understand the scientific discussions about these kinds of things. I will continue to wear a mask. I was a little not reluctant to wear a mask, but can be not the most comfortable thing in the world to wear for a long period of time. But it's going to be a long time for me to feel comfortable, Steve, where I can go into a public place and not have a mask, and not to carry hand sanitizer, which has become sort of something you carry in your pocket now along with your wallet. For me, it's a little too much too soon. I wish we could wait a bit longer, but I understand because I have friends, for example, in one case, a friend is not even vaccinated. And that has meant, of course, that we've not seen these people, my wife and I, and they've not seen us, and there's always been kind of a distance, and it has really strained, relationships, I think, where you are part of the vaccinated group, and then there's the unvaccinated group in my areas. You have to stay away from people. I miss the interaction with people, not just family. I sometimes worry, will my 3-year-old granddaughter remember Grandpa Bob? And all the food I brought to them during the pandemic became my new career as a chef doing takeout to help the family. So those are the things I miss. Just sitting around a table with perhaps a beverage, as now sadly the late Mr. Davis would have suggested, and talking about what Steve Paikin had done or said on the agenda the night before. I miss that. I miss that social interaction. I want it back, but I also want to do it when everybody can be safe and not create problems for anyone, anywhere, at any time.
Hang on a sec here, Robert. You and I worked together 35 years ago, and one of the first things I was told at CBC Toronto was you don't ever call Robert Fisher Bob. He's always Robert. Are you telling me your granddaughter's allowed to call you Bob?
Oh yeah, that's part of the deal. That's part of the deal. My catering service is often referred to as Grandpa Bob's cooking, soups and cookies and chicken things and so forth. But there's a few people that call me Bob, but I answer to anything, actually, Steve.
Okay, good enough. Quem, aside from my shtick there, Robert actually did make a very important point, which is to say that he's concerned that some of the decisions being made these days are not for epidemiological scientific reasons, but rather for political scientific reasons, as if the political calendar had more to say with what we're about to do, than epidemiology or good science. What do you think on that?
Well, I think Robert's right to a certain extent, but I also think that there's a we did a lecture recently which was all about Star Trek, and it was talking about the relationship between Captain Kirk and Spock. And Captain Kirk was sort of values, ideals, and also society. And Spock was supposed to be about science and making rational scientific arguments. And the question I was asking was, who does society want to drive the democratic bus, Spock or Jim? And though we all tend towards thinking that it should be a rational Spock type argument, we tend to choose Jim in the end normally. And Spock gives advice, and Spock gives good advice, but Jim drives the bus. And so, yes, we are in a situation where we have the death rate from COVID, which is as high now as it was a year ago. And yet some of the political calculus is that we can remove mandates. Now, remember, the advice from public health is, as Robert said, continue to protect yourself, keep your mask on in high-risk areas, keep washing your hands, get tested if you're concerned, and get yourself vaccinated. But the mandates have gone.
SARS took us by surprise in 2003, but you think it shouldn't have, right? Was this not its first appearance?
Yeah, so at the time when SARS emerged, there were two known coronaviruses that could infect humans. And as you read in that excerpt, they both caused just common colds. It seemed like a very stable family, a family that didn't change much. And that, even when SARS emerged, which we thought of as the first, pathogenic human coronavirus, it was understood as kind of just an aberration of nature, just something that was entirely a coincidence, and not some kind of comment or reflection on the ability of the family to jump from species to species and to become dangerous. Now, in the wake of SARS, there was some really interesting work done by scientists using something called molecular clock analysis, which is basically a way to go through the speed of mutations that viruses produce and kind of follow the thread of mutations back to the moment when a particular viral strain first branched off from its closest relative. And using this technique, coronavirologists went back and discovered that there was one of these known coronaviruses that now, just only cause common colds, had actually emerged in the 1890s. And they pinpointed the date to, the end of between 1889 and 1890. Now, what's remarkable about that moment in time is that it's exactly when something called the Russian flu pandemic swept across the globe. And this was a pandemic that killed 1 million people. And as its name suggests, it was commonly understood to be a flu. And it was only much later, after the advent of SARS, that it seems like that was potentially actually a coronavirus pandemic in disguise.
How shocking a revelation was this to you and your colleagues?
I think it's pretty shocking, and the further back you go with molecular clock analysis, you understand that the history of this viral family isn't counted in thousands of years or 10,000s of years as it was commonly believed. It actually potentially goes back as many as 300 million years, and that's a long time, and that's far, far before our species ever walked the earth. And so that suggests that, rather than being something entirely new, coronaviruses might actually predate our own species, and that we're, living in a coronavirus world, and we just happen to show up in it.
You mentioned Russia a moment ago, 1 million deaths there. Take us back 1,000 years to China. What did you find there?
Yeah, so, again, using this molecular clock analysis, there was another coronavirus strain called NL63 that, nowadays, again, just causes a common cold. But using this molecular clock analysis, it was identified that it first emerged around 1,000 years ago. And the further back in time you get with molecular clock analysis, the fuzzier the estimates are. What was going on in the 11th century, which is fascinating, is that China had emerged from hundreds of years of chaos into this dynasty called the Northern Song, which was sort of a high point of Chinese culture, economy, sophistication, and international trading. And it was also a point in time when 80 years of extreme epidemics racked the country. And so I went back and I looked at extant notes from physicians at the time, from policies that were recorded by the Chinese court, and discovered that there were a number of these epidemics that caused symptoms very similar to what a coronavirus is known to cause. And so, it's far, far back in time. We will never know for sure whether it was a coronavirus that caused this wave of decades of epidemics. But it certainly seems like it could have been the case. And it's also sort of, I would say, a cautionary tale in what happens to societies when epidemics are able to just run unchecked.
That's just some of what we covered this week. You can find the full conversations on our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.